What if I told you that numb feet, tingling hands, constant fatigue, and even brain fog might all have one possible connection? Many people blame stress, aging, or lack of sleep. But sometimes, these symptoms can be linked to low vitamin B12 levels. Vitamin B12 plays an important role in making red blood cells, supporting healthy nerves, and helping your brain function properly. When your body doesn't get enough, it can affect much just your energy. Today, we'll look at common warning signs, who may be at higher risk, and simple ways to support healthy B12 levels. Vitamin B12 helps your body produce DNA, make healthy red blood cells, and keep your nervous system working normally. Without enough B12, nerves may not function as they should, and oxygen delivery through red blood cells can also be affected. Over time, this may contribute to symptoms such as tiredness, weakness, or tingling sensations. Some people don't notice the problem until symptoms have been present for months. One possible warning sign is tingling or numbness in the hands or feet. This can happen because vitamin B12 helps maintain the protective covering around nerves. When B12 levels are low, nerve signaling may not work as efficiently. Of course, tingling can have many other causes too, including diabetes or nerve compression. That's why it's important not to self-diagnose. Do you wake up tired even after getting enough sleep? Low B12 may reduce your body's ability to make healthy red blood cells, which can leave you feeling weak or low on energy. Good idea to discuss it with your healthcare provider instead of assuming it's just stress or getting old symptom. Number 3. Brain fog. Have you ever walked into a room and forgotten why you were there? Or struggled to concentrate on simple tasks? Brain fog can have many causes, including poor sleep, stress, thyroid problems, and certain vitamin deficiencies. Vitamin B12 helps support healthy brain and nerve function. When levels are too low, some people may notice slower thinking, difficulty focusing, or memory problems. If these symptoms are persistent or getting difficulty focusing or memory problems. If these symptoms are persistent or getting worse, it's important to talk with a healthcare professional instead of assuming they're a normal part of aging. Mood changes. Your brain relies on many nutrients to function properly. Some people with low vitamin B12 may experience mood changes such as feeling irritable, low in energy, or having difficulty concentrating. These symptoms can also have many other causes, so they should never be used alone to diagnose a vitamin deficiency. The key is to look at the overall pattern of symptoms rather than just one. Some people have a higher chance of developing low vitamin B12 levels. Adults over the age of 50. People who eat a strict vegan diet, without B12, fortified foods, or supplements. People with certain digestive conditions that reduce B12 absorption, under medical supervision. Those taking some medications, such as long-term acid-reducing medicines. Having one of these risk factors doesn't automatically mean your deficiency, but it may be worth discussing with your healthcare provider if you also have symptoms. Vitamin B12 is naturally found in foods such as fish, eggs, meat, poultry, milk, yogurt, cheese. Some breakfast cereals and plant-based products are also fortified with vitamin B12. If you follow a vegan diet, checking food labels or speaking with a healthcare professional about your B12 intake can be helpful. How do you know if you have low vitamin B12? The truth is, symptoms alone can't confirm a vitamin B12 deficiency. Many health conditions can cause similar problems. The best next step is to speak with your healthcare provider, including thyroid disorders, diabetes, anemia, poor sleep, and chronic stress. If you're experiencing ongoing symptoms like numbness, tingling, fatigue, or brain fog, they may recommend blood tests to check your vitamin B12 levels and determine whether something else could be causing your symptoms. Vitamin B12 supplements can be very helpful for people who are actually deficient or who have difficulty absorbing enough B12 from food. Taking supplements without knowing the cause of your symptoms may delay finding the real problem. That's why it's always best to use supplements based on professional medical advice. White heavy checkmark, eat B12. Rich foods such as fish, eggs, dairy, meat, or fortified foods if they're appropriate for your diet. YW checkmark if you follow a vegan diet. Make sure you're getting enough vitamin B12 through fortified foods or supplements recommended by your healthcare provider. YW checkmark take care of your overall health by getting enough sleep, staying physically active, and eating a balanced diet. Small daily habits can make a big difference over time. Your body often gives you warning signs long before a serious problem develops. Don't ignore persistent numbness, tingling, fatigue, or brain fog. These symptoms don't always mean vitamin B12 deficiency, but they are worth discussing with a healthcare professional, especially if they continue or get worse. Early attention can make a real difference. If you found this video helpful, subscribe to Health Elevate for simple, science-backed health tips that help you make informed decisions about your well-being. Thanks for watching, and I'll see you in the next video.